So they're good at that. Well, we're not good at things, availability, which is funding. And just put service fiction after the substance. Well, you know, this is dopamine stuff. I have to get around because I'm like, oh, I go, oh, so why did I send it? Which is the good stuff. That's what oh, yeah. Yeah, that's what it's done.
So I.
That's what it's done.
Yeah. And I mean, he looks at me the whole time in my face. Like you're talking points. Yeah. That's amazing. Yeah. That's right.
Yeah. Yeah.
Oh, sure. Safe harbor. Yeah. Or safe harbor.
So like where?
Yeah.
So.
Because he made safe harbor happen. Yeah. His original. Yes. And he loves safe harbor because he said that to everybody. Yeah. And I personally just got.
Yeah, definitely.
And we're all. I don't know.
And you're adjusting this thing.
Well, no, I think we need that, yeah, it's 5 years.
Or everything,
It's all right.
like Reagan.
Yeah.
Yeah, it is just that. And so, but there were some,
I looked at it.
so there were some things that they got of that.
So I did.
Kind of tore those down. I just kind of spaced out at one point where he just
I mean, a
kept
lot of
coming up with, he had very specific sayings. So I think you guys, so I would think that those buzzwords meaning something.
Well, and that's the one
Like,
piece.
it is not lost, that coordinated and trees.
Separate those out.
They know.
That's the shit, the general.
And that's fine. Somebody asked the question,
So that's, I had to
I
separate.
feel like Kevin asked the question.
It shows the two halves.
About coordinated and trained, how it works with. And then he gives us that, he didn't change it, you know, working along that, he basically said, well, even though I agree all. People.
Yeah, basically, shake it on and stuff.
Fixed first, so I had the human side, I'm not kidding you, that I had the human side of me was like going crazy. I had a, he said, the people with the highest security, the drug users, the, this is how we call them.
Right.
Drug, people using drugs, need treatment, all of those things. You're not supposed to take care of them.
They're lost.
They're lost.
They're lost.
Basically.
It's like you're triaging an emergency
Yeah.
disaster or whatever, and you know people
Yeah.
are gonna die, they're not gonna make it, there's people who can, they're okay, they can walk away. It's the people in the middle you need to worry about. We've had a little bit of that conversation during like the task force meeting. I remember when I was first starting, around, are we? But then $1 million Murray, the cost is over here.
And that's what the issue is, and that's what the issue is that the cost over.
You want to
here-
take away.
That's why I had to take the human out and say, like, okay, we know that we need to change our code. Yeah, well, I mean, that's what I said.
We need to go back to.
We need to go back, he said, he basically said, we need to go back. 33% emergency shelter, what was the other one?
It's cool.
Transitional housing and then permanent support.
All of those, and then.
Yes.
You know,
They're talking about
if I take out
The same way, it was different.
there's lessons to
Mhm.
learn. So my takeaway was that.
I don't know what about the subject. The event. We have, like, we just get real scared there. Like, cool, I'm listening to all the time.
Right.
It's not. I'll call it that. Leadership.
But there's gotta be.
Joe?
Some people brought it.
And.
I just looked at my clock to see if we.
Oh, sure,
Sure be.
Yeah.
I just wanted to plug with Barb.
I said they.
Very good conversation.
Oh, yeah, they.
Good.
So.
We've actually got that moving
It's gonna be
forward.
right. I wasn't. But she.
You clearly.
Yeah, on 16.
That's how I guess I'm putting in funding allocations, you know, doing some shows, you can go back to the way.
Good for
ESG.
No, but then I'm probably.
He's 7, and I'm
Just,
I believe.
there was something not to take
Okay.
away. Yes, yeah, they.
Yeah, I think she's done marketing. Really nice. And
I only have to do people.
she's like,
Yes,
a lot of stuff, like she's up on all the stuff on the library with, like,
Yeah,
vendor to go in there. and
Right.
stuff like that. I got myself running on a case, yeah, I'm keeping it for class.
smart. I know, it's looking like, I got genius.
I didn't read the phone and then days later remember that.
Yeah, I couldn't even, I would not survive a day without a kid.
No, yeah.
I do the same thing.
So there's 8 more besides you and me. Does that mean 4?
Yeah, we have one. Yeah, there is those,
I don't know if you've met, me, don't.
I'm
I don't think we talk to each other.
We've done emails.
no, well, let me make sure. Okay.
Cause Amy's here, so.
Actually, I'm gonna do this.
So we're gonna get started, everybody. I just wanted to, we're just checking to see if we have quorum. I think we,
One short and Janina will be here.
okay, so we're one short and we'll start with the consent things as soon as we have quorum. Welcome. I'm very happy to see you all, meet you all in person. My name is Sandra Newsom and I'm the newly elected chair of the Funders Council. I've been part of the board of directors for Pinellas County CoC for about a year now. As a resident of St. Pete. And right, that's my still at large person, but I also have a background in supportive housing and housing development. I'm part of the Florida Supportive Housing Coalition, which is an advocacy group. And I've been part of a couple of other COCs across the state. I work for Carrefour Supportive Housing in my full-time job. And that just takes me all over the state of Florida because we build multifamily developments that are affordable under 60% area median income and really focus on the deeply subsidized units at 30% or 22%. I try not to speak in like the HUD and the housing language, but I think most of you are probably very familiar with that. So I'm really excited to be part of this group. When I was asked to be involved at this level, I took the opportunity to do so because this is an area that I think in my work, I'm used to the funding sources I utilize. But what I think is unique about Pinellas County is all of you here at this table, that you're part of a funders council. I don't believe there's another COC in Florida that has a funders council. And I think that is a huge kudos to all of you because it is not just HUD funding, it's not just the state funding, but it's a local funding that comes in to support the work that we do to keep people from becoming unhoused or becoming homeless and staying housed in developments. So that's my word for today and Friday afternoon. I also want to congratulate everybody because it is Friday afternoon and that you're all here. So that really speaks to commitment. So thank you.
We have
All right. So why don't we get started? And I'd like to start by you all introducing yourselves. I think most of you are familiar with each other, but many of you are very new to me. So who would you like to start?
Sherry Holtzbacher, CEO of the Homeless Leadership Alliance.
Lizzie St. Pierre, Community Services Manager for the City of Pinellas Park. Ellen Rhymes, Social Services Planning Manager for the City of St. Pete.
Amy Foster, Housing and Neighborhood Services Administrator, City of St. Pete.
Rebecca Stevenson, Grants Coordinator for the City of Pinellas Park.
Karen Yatcham, Human Services Director of Pinellas County. Sarah Witter, Second Largo, Housing Manager.
Bill Mayhew, I'm the housing manager for the city of Clearwater.
Joe Riddle with the Pinellas County Housing and Community Development, the grants program.
Thank you. Nice to meet all of you.
And Amy is new to the HLA.
As I go.
Hi, my name is Mimi Kodo. I just started. I'm the HLA the COC Administrative Coordinator, but I'm here today observing and also doing the minutes. So, which you'll see later.
All right, so on the consent agenda, we have the approval of the 12/19/2025 meeting minutes. Along with the summary, do we approve each separately?
Just general consent overall, if anyone has any
Any comments,
corrections.
changes, disagreements? Have a motion to approve, with
So moved.
a second,
Second.
all in favor?
All right.
And that would be for the first two? Okay, well, the funders schedule, is there any, just to highlight that because that is our commitment for the meeting. Is there any changes or questions about the schedule for,
This is the joint vendors meeting schedule.
okay, so we don't have any changes with that. But we do have to address this meeting schedule, right?
Yeah, if you'd like for me to speak on that for a moment.
Yes,
to-
please, okay.
One of the issues that has happened with funders council is that in the charter, it says in order to have quorum, everyone has to meet in person. And so it has been, there's 2 meetings a year for funders council. The charter has not been updated since we started the joint councils. And so there's going to be a work group with 3 folks from each council getting together, working through those changes to make sure that those charters are aligned. And then we encourage more, more quorum, incentive for people to show up and for us to be able to conduct business. So that is, right now, though, it is like the very, I believe it's in December and then again in February when we have funders councils set up outside of the joint council meetings.
So the discussion about the work group will happen during the upcoming joint funders and providers group.
It's going to be, we already have the 3 people from each council who have signed up for that. And so they'll be meeting over the summer at some point.
I guess, Sandra, the only thing I'd say about the schedule, I mean, I certainly think it's hard to get folks together, and so maybe quarterly is what's feasible. But, I really have concerns about the urgency of a need for system redesign and planning, and I just don't believe that can be done on a quarterly basis when a NOFO should be dropping again sometime soon. And we have large system considerations to make sure we stay as whole as possible to serve as many residents as possible. And so I think we keep this and certainly don't shift it. But whether there's a separate committee or this group needs to meet more often, there's something that needs to happen for us to be, prepared for all the changes that are coming down from the federal implications. That's kind of my concerns.
I'm on board with that. I'm just curious, so we had a dry run in December for the NOFO. Chances are that it's not going to change dramatically. It's very clear that in some of the conversations that HUD has been having recently, that we're going to see the same substance in the NOFO because according to Dr. Marvitt, litigation is based on technicalities and not the substance. So my takeaway is that that will not change. That's going to happen in about less than a month. They're court ordered to come out with a NOFO by June 1st. So we'll have a quick viewpoint within a short period of time of what that will look like. How do people see that impacting the work you do? Because I think Amy's absolutely right. I don't know that any group is positioned to respond and figure out a game plan for what might need to be supplemented in what we anticipate major cuts to be.
Well, and I think we didn't even really finish the conversation from last year, right? So everybody did things to fix things quickly, which thank goodness. But there are implications based on what we did. Federal funding can never backfill that again. And so if JWB backs out, if city changes, we made changes, county made changes. So there are still very hard conversations, regardless of the NOFO, that need to happen, especially considering at the state level, we are still, looking at some kind of reform with taxes possibly. And I just think there is the need for some robust conversation, regardless of the NOFO.
I agree.
The work we did to save beds has irreversible implications moving forward that we now need to talk about and figure out how we're gonna, manage that moving forward.
I have a few questions. The, in terms of the court order, I thought I had seen something recently that said they found it was unconstitutional to unfund or to defund some of the things that they were looking to defund. I didn't know, or like through the mechanisms of that NOFO, but then I didn't know if they were actually looking at like budget cuts on the other hand. Like as far as getting away from PSH and putting it toward the short term, that it was found not to be legal to do that, but that they could potentially cut on the budget side. Is that not correct?
They're
They
actually
still-
adding to the budget.
Okay,
So there will be more funding,
okay.
but the issue with the FY 25 business was a problem because we had an FY 24/25 NOFO. It was supposed to be for 2 years. And the rate of change and the procedural not being, the procedures not being followed as far as like notice and just the timing of all of that was a problem. And so they were forced to go back to the 24/25 NOFO. There was HUD had appealed. They did not get that appeal. Congress passed the Appropriations Act. And within that act, it says that HUD must renew any renewal contract that has expired the following quarter, they must renew. And so we know that has happened with some of Boley's projects. They were renewed, or they received a conditional award. And just recently, Kevin mentioned that he finally received a contract. So that's good. When it gets paid out is another story. So we're taking it as it comes. And so what HUD was looking to do was to send out a FY 25 NOFO for the Q3 and Q4. That would cover HLA, like coordinated entry, HMIS, and the planning grant, as well as CASA's projects. And possibly some Eboli's at that point, but most Eboli's are earlier on. And so that's what was denied. And so it looks like right now, HUD has dropped the appeals. They're going to go ahead and pay those out, or contract out, and then like they would have a year and a half ago, like that was the whole plan. And then now they're going to come out with the FY 26 NOFO. So they're being held not so much by a constitution, but because of congressional appropriations.
So that's my other question. So the current funding expires September 30th and the NOFO for June, or when it can
Actually,
state
it's like so Boley is a special, their funding ends December 31st for one of their contracts. Most of the contracts that most of the agencies or projects, they have their scope, like ours goes through till September 30th, 2026. And that is for FY 24. So we are covered right now. And once we receive an FY 25, it'll go from October 1st, 2026, all the way to September 30th, 2027. And so this NOFO that comes out right now is actually going to affect October 1st, 2027. For most projects. For Boley, it'll start December 3rd, like January 1st is where, because of the way that this is directly contracted with HUD, and that's how they have that set up.
Right, so any contract, HUD's funding is, all of that means that anyone who applied in 2024 for the 2-year NOFO, that was funded. The contracts are being slowed down and they're out, but people haven't seen the money yet, but it is coming because HUD had to release the contracts. So anything that HUD, the application that is gonna be submitted during this next round will cover the end of, whatever your grant period ends, starting the end of 2026 through 2027. And that will most likely be an annual NOFO. They won't do a 2-year NOFO. That's probably not even part of the dialogue at this point. What I'm questioning, and I don't know that it's clear, because in the public statements, they're saying $800 million additional funding attached to the NOFO. The budget has a reduction of funding, and that money is coming from somewhere, and it's suspected it's coming from either CDBG or other dollars that go past through HUD. So there's no transparency in that, so it's really hard to be predictable on where, like, if that funding is gonna increase, where we're gonna see the increase, but know that there's a deduction from somewhere else, and we just haven't seen that, what it would be. But I also think, Amy, if you could, just for clarification, when you talk about what was done in response, and then there was, that we can't go back and fix easily. Can you speak to that just a little bit? I think,
I'm gonna forget the issue, but I think you and I spoke about it, that once local funds have been used, you're not able to go back and use federal funds again.
right, and I think that was brought up on one of the advocacy calls that you and I were on.
It was.
It hasn't been discussed since. It could be the kind of like, don't ask for clarification on that, because I think that, I don't know, because I've been paying attention to that as well.
I'll get with Avery and get the official,
Yeah,
part of that, but I think, it's something we need to understand better so that we can all work together.
right, and I think that that's part of the important part of, systems redesign is when you use other dollars to fund something that the federal government's funding, oftentimes it looks like the city can take care of it. And since we know the current administration really pushing things back to the state, anytime the state and local municipalities pick up the gap, then it's harder to go back and reclaim it as a need. So I think that has to be heightened in our awareness of anything we discuss in terms of relating to supplement any shortfalls in the HUD funding.
Well, just one thing to note, at least for the county funding, ours required a payback. So, I think JWB did the same. I think,
I think so.
but we put that in there. So, and Kevin and I are in dialogue. So once he gets his funding, he has to return what
So it's a bridge.
it is only a
Okay.
bridge with a payback.
I don't think I realized that. And so for us, this is good because then for us, what we did was repurpose home funds, which are already federal funds. And so we may have less of an issue, but I just feel like at the board level, there's not a lot of time to kind of wrestle with these types of things. And Joe has a rush funding allocation. We just got a rush funding allocation. We still have the DR things to work through. And so I think there's a lot of potential, like during COVID times where we met fairly regularly to make sure that all of that funding aligned and that we weren't having to return funds and that kind of thing.
Yeah, I agree. I think we need to be, and meet more frequently, if we're not going to vote, maybe it can be, virtual meetings until the charter changes, but I'll just speak for my side of the county, the opportunity to do supplemental or gap funding, that's gone. Like my ask was one time, it was an emergency. I've had subsequent asks in relation to providers asking, and it's no, like we're not bringing, the county is not intending to backfill losses in federal funding. Like they've said it at meetings, even when I'm asking, it's a no, we're not doing that. That was a one-time special situation because of how quickly things were moving. So I do think collectively we need to have those conversations about what are potential impacts with the HUD changes and what are real things we can do to shore gaps up, or we have to get real comfortable that there's going to be gaps that we can't fill. I think we did a good job kind of like pulling a small group together and making action. But we didn't have the infrastructure of Funders Council and the discuss, like, we didn't have it. So I don't think we can meet twice a year in the current situation, and we have no idea what's gonna happen with property taxes.
I mean, I frankly still believe that the potential for COCs to go away is on the table. And so we need to be talking about that and what that looks like. And so, sorry, Sandra, I probably got us way off track from the Joint Funders and Providers Council meeting, but it just felt like a good time to
No, I
talk about schedules and what feels.
No, I absolutely think this is really important and helpful. Because I do think this has significant impact, so how do we make it most efficient use of everyone's time, but also to do the work that you all do? How do we tie that in? So what I'm hearing is twice a year isn't sufficient. And this is just me asking out loud. You need quorum to pass something, but you don't need to have a meeting virtually so we could brainstorm and do this. You don't need to have quorum. That's a formality.
There can be work groups and emergency work groups called, and all ad hoc work groups, and all that can be, absolutely.
So perhaps once, I guess, the big unknown is what the NOFA will look like. We should probably plan on a follow-up discussion once that's released and people have had a chance to digest it, kind of analyze it and think about it, and then maybe do a meeting virtually.
I think one of those first discussions that's got to be had is how is the rush funding going to be able to fill those gaps with BOLI between that period of time and figure out how this one-time set of funding is going to be able to best be used
The future.
to move through where we're at with this extra funding we have at the moment.
And the rush funding is I'm not as familiar with that. What is it?
It is ESG,
Oh, it's ESG, okay, yeah.
but it was a special supplement for both the city and the county for major impacted areas from the hurricanes. So we had $515,000 from January of last year. We've got the 1.6 that is moving through approval as we speak. So we'll have that 1.6 to be able to figure out how it fits in and best helps from the county side of the house with this NOVA when it drops.
And we have 2
So if it's ESG, can it fund fully? As a
No.
permanent or?
It can fund,
Shelters, emergency shelters.
so it might be able to fund Safe Haven. And I pulled this up the other day, and it's so hard because HUD's removed so much stuff off of their
Yes.
website. But I was actually able to find this the other day.
Prevention and rapid rehousing.
So for rapid rehousing and prevention dollars.
We had that discussion in our meeting Tuesday, is can we get transitional housing in that emergency shelter bucket? And we need to, again, another discussion to see if that's how we can do it that way.
So I wasn't clear on whether or not that was, I thought at the end, I felt pretty good about what Edie said, and I said, if what she said is true, then transitional housing could be looked at as emergency shelter. But then I thought, and Avery had the same thought, if you can only use 60% total for emergency shelter and street outreach, and you drop transitional housing into emergency shelter, well, then you've just taken away what is true emergency shelter.
Yes, sir. But
HUD doesn't fund emergency shelter anyway, typically, right? So. I think this proves why we need to have other discussions, because there's so much that we all do with our general funds already that maybe we don't need to be funding rapid rehousing anymore at the local level because we have these other dollars and we can use these for rapid rehousing, and then the county and city could fund something that we're not, and so I just think there's some opportunity to align the system as a whole. through those
Absolutely.
conversations.
And I think, because that's kind of right now, we're using language that we anticipate being in HUD. HUD, according to what I'm hearing, is gonna fund emergency shelter, transitional housing and PSH, 1/3, 1/3, 1/3. That's what the goal is. So where they haven't funded emergency shelter or transitional housing for many, many years. So it'll be, I think that is an important distinction that we kind of clarify for this group, so that when you're deciding on what to prioritize, it's not overlapping, but it's kind of and it's not supplementing, because that funding is not gonna be what people apply for.
Stabilizing.
Yeah,
That's something that we kind of talked about at the meeting, the rush meeting, is that we know transitional housing is big for HUD. We have these funds. We do not have true transitional housing in our community. West Care is the one that I could say that is in our HMIS. I shouldn't say we don't have it in our community. I should say in HMIS, right? That's West Care.
And tons of transition.
Yes, we do, but it's not, they're not HMIS. And so how do we use the question, Joe and I asked kind of, what do we do with this rush funds, and can we have money here now? How do we stand up this transitional housing now, so that we have something to present with, like we have some data, we have some things, like it's only a couple weeks away, but at least we would have some additional transitional housing already here.
do you have rapid rehousing here besides?
City,
We fund.
yeah, city, yeah,
Collectively
CP,
fund.
yeah, and the county funds.
And we have a county program, that county staff that do work as well.
And when it comes to rapid rehousing, Dr. Robert was pretty clear, let your local people do it. That's pretty much what he said.
When I think we're one of the only places in the country.
Yeah, and let the locals, you could do it at the local level, basically.
Well, transitional housing, what it seems like,
Take your money from PSH and put it back into transitional housing. They did that, flip it. They only had 60 days to do it before, so do that.
right, and it's focused on treatment.
Yes.
So rapid rehousing was focused on non-treatment, and I have a rapid rehousing program that was a transitional housing program that we just went, okay, now you're rapid rehousing, same people, but it wasn't a focus on treatment.
Yeah.
So, all right, so these are really important conversations. So what I'm going to, we'll follow up with a ad hoc, whatever we decide to call it, after the NOFA comes out to align this, and that will happen probably in June. If the NOFA comes out at the beginning of June, will that be enough time for these dollars to have this discussion with the rush dollars? Because when does that kick off? Now? Or you start spending now?
Well, we've got our first allotment, we've already allocated to agencies, the county has as well. And so now we're in the process of working through what we will do with the second one.
So would it make sense, because you have this, that when people submit an application or their request for funding for the milfoil, that it be more of a universal, so that you're also submitting for other dollars that might be available within the seed continuum?
I felt like years ago when we did the universal, that worked out really well, because it was during COVID when we were flush with money, right? And so as other things came up quickly, we were able to just respond with the next ranked activity instead of running another thing. Avery's not here, and that's not Helen's expertise, so I would defer to Joe about what's, if we would be able to do that under ESG alignment or not, or requirements.
And I'm not sure until I think we have that big alignment to decide, do we need to go first with Rush and the NOFO happen? The NOFO happen. We fill in the gaps after we've identified what that gap is after the NOFO. I think that was the discussion we had with the Viters Tuesday. I kind of put the NOFA for our Rush fund is going to be determined by what happens with the NOFA and what we need to do.
Mhm.
So I think, I'm not sure till we get a little further along in that path of when, or maybe we do them all together, and that's a possibility too. So, again, I think it's kind of contingent on that NOFO and then going from there.
And I would, that's not my area of expertise, Amy is right, I don't know, but what I will say is that Rush, remember, is ESG light. And so those are individuals, 30% AMI.
Yes.
And so it's really hard sometimes to use those funds.
We have a lot of seniors.
We do, but even when it comes to rapid rehousing, while they might have that help, like we have an apartment, we just tried to put seniors in, they have places, but they have to make $2,000 a month at least. Yeah,
Is that a roommate situation or just?
it could be two,
Thinking them together, maybe they.
but one back, yeah, one
Yeah,
back.
that's true.
Um,
We had asked our HUD rep a while back about unified funding, like for CDBG and things like that, we could do it. Of course, it was the like, well, it depends, it was not like, sure, absolutely, even though obviously it would save a lot of admin costs and time and everything like that and streamline it, so. But I do have her response somewhere in my files, feel like it's a good channel.
can I just ask a question? After the no drops, can we speak?
Yes,
So when can you not, have the meetings in those?
we can continue to have meetings, and we don't have the same rules, like every group has its own cone of silence. Okay, so cone of silence is really between the review and rank committee and project applicants, where you can't go and lobby for your project with
Got
the
it.
people who are going to make those decisions. But you can have a public meeting, yeah, that's
So
totally.
once you choose your review and rank, so use the same that were chosen, and they may not be able to be
Right,
in the room to have the conversations.
Right, but
And are they the people that need to be in the room, I guess is what I'm asking.
Yeah.
no, but I think a work group can meet outside of COC staff and the ranking review committee. That under any cone of silence, but I think if the providers are in the room and they all have access, that doesn't violate the cone of silence, in my experience, so. But I don't think this group is gonna be. I mean,
Now we're deciding who the projects that go forward are. Like, does that, not going to be deciding who the projects,
but it's also the perception that someone had access to you to
Right.
lobby for themselves.
right, that, yeah.
Right, so, that's really where the concerns come from, but a good question. So this is really helpful, thank you for me, just to kind of ground a little bit where you've been and where some of the concerns and some of the, like, we need to do issues are. So I have it on my first task with Sherry to schedule that call once a month. And we'll do something in anticipation so people get it on the calendar. But since we already started talking about the NOFO, you're on.
There's nothing really new to add to what was just discussed. It looks like the same, here's the thing, same priorities are going to be in place, of course. But what I noticed with the two NOFOs that were kind of alike, is that they were very different. So the priorities are still in there, but the brass tack, getting down to it, what's going to be in there is anyone's guess at this point. We just know that 60% is going, that Congress said at least 60% must be tier one, so that's not a competitive piece, which is better than the 30% that we had the first round. If you'll remember, usually we're used to 90%. And during COVID, I believe there was a point where it was at 100% was tier one. We could do all your renewal projects. And so we will see. And the only other thing I have to add to that, besides the timing, it will be dropping. I would say, I believe it's going to drop the Friday at 11:59 PM after Memorial Day. That is going to be possibly Saturday. We'll see. But that's my gut feeling. And HUD has indicated that they will give actually through August to go through this, which would be nice. I know we've been concerned about the first NOFO was like a 60-day turnaround. It was very, very, very compressed timeline. It takes a while to put on a local competition. And so going through August would make this more like a traditional NOFO in that sense for timing. And then HUD has also indicated that they would be making conditional awards by December. strategic planning, if Stephen Bronte has reached out to you for an interview, please follow up with him. You all should have received the surveys. I hope that you do respond to those too, as soon as possible. And we have our strategic planning work group that is well underway. He has all the information from the gap analysis, our our PIV report data from the past year. And all the other information was collected from general membership and from this council and providers council and feedback around recommendations that we've been collecting. And so he's putting that together and we should have our strategic plan then in front of the COC board by the July meeting. That's all I have around that.
Okay, all right. Ariel, you're on.
Back and forth from the reading glasses and that's kind of. So you all sent in information to the HLA on your different programs and funding and so forth. And then the big spreadsheet that got sent out, it was a pivot table was based on some of the conversation we had at the joint funders providers council meeting on things that we wanted to see, kind of cross reference with it. So, funding by program type and then also how much is recurring and how much is one time. So I know like even during COVID, we got a lot. Now it's hurricane money, we have a lot. I did the yellow highlights you'll see. I think those are some areas we still probably need to dive into on the spreadsheets a little bit more. I was talking to Sherry before the meeting, for example, prevention. If you scroll into the big spreadsheet, it looks like it's got more like housing development and housing rehab in there, which maybe we break that out to home preservation or housing preservation or something, and then have eviction prevention or foreclosure and eviction prevention as a line. Because I don't think we're spending $38 million on eviction prevention in the system currently.
That's CDBGDR in there.
Yeah, I think that's but that's not all eviction prevention is like actual true. It's like housing rehab and stuff like that, like to get people back in their homes and all that.
Yeah, when I pulled it out, it was like 32 million.
Okay. So I think that's one area we can definitely break out a little bit further, but it would be good if we can get to the point, especially with these blank, anything in the blank, go back and see if it's in your jurisdiction to fix. Bill and I were just talking, it sounds like he's got some more Clearwater. When we were conversing too, I think we probably need to today get on the same page of what we want to include. Like, is this truly just the homeless system aspect or that surround, like we're talking about with the home rehab, or affordable housing development? You had mentioned even like food banks, like where do we put the bumpers? So I don't know if we want to pause for a moment and have that conversation about what we want included on this sheet as far as what's in the system. I also noticed on one of the other ones, it looks like we don't have the VA money on here because it was really low on the second page for veterans. We showed $99,000 for veterans population. So I think that's another gap we need. I know they're on cover, just not here today.
I wonder, if I look at it just at program type, I feel like behavioral health has, like knowing in the future, NOVOs, there's a focus on treatment and things of that nature, that we should include that. But maybe we don't include affordable housing development. Maybe we don't include food assistance. I kind of think the healthcare and medical services, that comes up in the NOFO quite a bit. And so because we can break it out that way, I don't see any harm in having it in there.
And we're unique in that we have the H, like the, from FQHC specifically.
We do have the funding by stage also, so if we do think about like permanent housing, we just would have to acknowledge maybe it's the difference between permanent housing and permanent supportive housing. To show, it may be affordable housing without the wraparound services, but it may be important for that aspect too, like we are building the housing to help people stay housed or get housed. But also, maybe we need to include on here a breakout of what's local money versus federal and state too.
I have one thing to throw on the table here to muddle the waters even more. We take a look at here, we ask, how much money we got in the system? We got $74 million and somebody's gonna go,
You don't need.
why do you need any more money? We take this same spreadsheet that we got and our one-time occurrence funds, we can break it out. And then we get back to a true amount of money that we've got in the system that we know we've got to be working with. There's $38 million worth of DR funds that we could use. But how many of them are gonna get there? So I think taking this, I like all the breakdowns and everything here, then we take the one-time money out of it. Then we've got a true one to work from. And we have our one with our one-time funding sources that allows us to know, well, we've got 3 years that we can use this to help fill the gap and everything else. Because I would be afraid to show this to somebody and say, yeah, we got $74 million in the thing, but we need more money because we can't do this.
Yeah, I think we had that exact conversation the last time we looked at this. I think that makes a lot of sense, Joe.
And we can do that. We just have to fill it. We have to get those blanks because right now we have 45 million in blanks. And we need to know which of that is recurring or one time. I don't think it hurts on the big master spreadsheet for us to have it. And we could say, this is what we have currently like ongoing in the system. Here's what we could use to make a big impact change in the system because it's one time, but here's like.
Yeah, because that can be filtered out if those.
Yeah, we can
those are-
filter, we can filter it out, but we've got to get the blanks since it's the majority of the money right now is still blank in there and figure out. And I think you had mentioned what you were defining as one-time recurring.
I did, because I was getting a lot of questions around that, and there are no recurring funds year to year, they're gonna be the same. They're just not, as far as like the same dollar amount, but recurring pots or programs that happen. So yeah, we can expect to have ESG come every year. We don't know how much is coming. We can expect that, the NOFO, that the HUD COC program NOFO funding for now is recurring funds that come through every year, but we don't know how much is necessarily going to come out. Same thing with DCF,
Right.
and so so I was trying to just differentiate between that, like, yes, no, we do not know how much that's going to change. That depends on budgets from federal or state, local. But if these are deemed to be funds that our program is going to keep going rather than rush or disaster relief, then we want to know that because we can put more of our eggs in those baskets, knowing that those are going to continue to go.
So then I would say then that would change what we just did based off of Joe saying, pull that out, because to your point, I would have put social action funding is reoccurring those things in those areas, like in prevention, because you said keep the program in prevention, just show that it's reoccurring. So I'm gonna say we have $300,000 right now out in prevention and social action funding. Doesn't mean that's gonna happen next year. It means that's where we have right now. But if we're pulling out what's one time, then that would change that thought process, then I think.
I'd rather be both on the master spreadsheet, but then we can like condense it down of what we show, like this is what the operating budget is basically for the homeless system. And then this is the additional fund, here's capital improvements and here's additional one-time resources that then because of hurricane, or because of COVID or whatever, that came on.
I think to your point, Helen, that, CDBG, ESG, and our home funds, they're gonna be there moving forward. Those special,
Yeah.
They're here today.
Everything's not recurring now, but okay, yes.
it's not in the budget for 27, but it's gonna be there.
Yeah.
But those special allocations, our home arts, our CDBG, DR, our rush fund,
Yeah.
those are those ones that I'm talking about that we need to pull out because we've got big buckets at the moment
Right.
in order to, again, get back to that operating budget we're talking about.
Right.
My $205 big $1,000 worth of ESG, you know, it's gonna be there next year, and we know that it's gonna be there to be able to be used. ESG Rush won't be here 2 years from now, because it's gonna go away. So that's my thoughts.
The other thing I was mentioning to Sherry too is, like some of the interventions are less expensive than others. So just even comparing like how many people are served and so forth, like the per capita cost, we might be able to see that, but you know, just looking at the whole bucket doesn't necessarily mean we're underfunding one. It could be more cost-effective strategy. So I don't know if that's something we want to look at, and I'm not sure if we would use the data like, our annual data of how many people are in rapid rehousing or other eviction prevention programs, or, you know, like stuff like that, or not other, but eviction prevention programs. To look at that.
Ask CSP to pull that, like, because we hear forever that we need prevention, but we have nothing to justify that we need, there's nothing that we can pull data-wise to say prevention, we have this many people that have been in touch with prevention and it works. So we've been trying to dig into that at DSP a lot. Like, how do we pull the data from HMIS that's going to tell the story of what we're using our money for? And if it's being effective. Trying.
I think
That's
our-
goal.
Yeah, I mean, I would love to have the data to prove that. I think it's a system flow issue, right?
Mhm.
That you gotta turn off the faucet for the tub to not overflow, and it is cheaper than any other intervention. And so, in previous system design, that was the thought. Is, you know, we have a significant inflow and we've gotta stop the inflow.
I think with that, especially where the tide is headed though, it like, how do we bridge the component too that we're pulling in, either the workforce component or other things, that it's still a short-term assistance with whatever, financial stability, case management or what have you, so that they are to a place financially that they're not gonna need long-term subsidy.
I mean, it seems aligned with what Dr. Marbutt would like us to be doing, that he'd like us to spend our resources on the shallow end.
He doesn't want rapid rehousing. I can just say it this way and maybe this will help. Like, he said it this way to us. Rapid rehousing is almost like welfare. It keeps people stuck in that place and you're continuously helping them over and over and over again, and they're not getting out. That's how he said it. Sandra, is that how you heard it? It did.
He didn't go into Miami version was a little different, but similar, yeah. And I think, he was focused mostly on transitional and his stories.
Okay.
So it's hard to unwrap, but rapid rehousing is, his description though is the opposite of what rapid rehousing
I
is.
know.
Okay,
I know.
I'm still shaking my head from
Yeah.
yesterday, so I'm still trying to like, what did he just talk about? But, how do you measure now? Like
What
the
it costs.
impact of these dollars?
I know during COVID, it seemed like we had some data, but I don't remember if it was local or like national data. We could see, I mean, we had so much rent assistance go out to keep people housed, like the cost per household was like $3,000 or $4,000 to keep them housed. So I don't remember if we took this, you know, whatever the shelter, it obviously would be per night because that doesn't suffice, but how, like, we took the average at that time during COVID, it was longer, so it might have been like over 100 days times the nightly cost of shelter. I don't remember exactly.
So I guess I'm gonna ask, because this is really basic for me, because I'm not as familiar, so forgive me, but if someone makes a call and they're at risk of homelessness because they can't pay their rent, in my mind this works, but so they make the call, they press the button, they go to diversion versus to shelter or outreach. The diversion funds could come from the county or the city, right? And then where does it get closed off on? Who keeps the data? Is it HMIS?
It comes in HMIS,
So
and
everything-
HLA also has some diversion, and we also subcontracts and prevention.
But just Sandra, just because your COCs may be different, let me describe how previously, I don't know how it's working now, previously how we interpreted diversion was prevention is what you just described. Diversion is my bags are packed, I've been kicked out, I'm on the front porch of the shelter door, and now I'm trying to divert from that. So that is going to be usually even less than what we would spend in prevention because it's making a phone call to Auntie to say, if we give you grocery money, can they sleep on your couch kind of thing. I don't know if that's how it's
Or
considered.
a bus ticket back to where you came
Right.
from, or, yeah.
Right.
But all of that is made.
In HMIS.
In HMIS.
So that was my ask, is how do we pull that
Right.
data and say they're still housed? And you would only know if they've touched the system, so we started in the collab with a recidivism report, have they touched the system again, 30, 60, 90, 120 days? That's the only way you really know.
And you don't have that data match.
I imagine HMIS could pull it.
Because that would help with the discussion of where the dollars needed. If those dollars are being used effectively, then that's a good thing, correct? Like, is that what you're trying to?
That's what I was thinking, I mean, for both the share with legislators and the board electives for funding too.
I think it would help us understand where we need to put our money.
Yeah.
Yeah,
I don't know how else outside of providers telling us what they need, I don't know how else we would determine what's the best use. Like, the reason why I started with prevention is because regular prevention versus targeted prevention, which I hear and anecdotally from agencies who've done it, right? It works really well, the targeted prevention, but we don't have that data to show it. So instead of doing that, I say City of St. Pete residents in general.
I think our seniors are really falling into that. Too, because they're not tech savvy to look for help until they're already out, and then they're on fixed income, so you can't just give them short-term rent and get them back in, like rapid rehousing is hard for that. So,
And that would be really helpful to know how many of those folks are seniors that would qualify for the federal funds. So I think that's what you're referring to, is if we know where we can use the federal dollars, then we know where the local dollars could be better spent. And if we knew how many of 62 plus were falling into that, then we would know. I think that would be helpful as well in terms of for the COC to prioritize the populations they need to identify for the NOFA.
And 62 plus is a priority.
Right.
and the area agency on aging did their strategic plan not too long ago. And HLA provided some really good data on that, which we took to advantage plans like the housing compact group at the county, on that. So to try and promote getting like senior housing density bonuses and some other stuff in place for that.
We do plan on, just like what you're aware, we're working through our RFPs for nonprofit public services for what I'm gonna call the first tranche of CDBG-DR. Because our CDBG-DR for nonprofit public services is not that there had to be a storm impact, it's that the storm caused an additional need for human services. And there will be a senior component to the housing RFP. So there will be some resources. There will be $2.5 million worth of housing resources infused into the community. Homeless prevention and services will be a part of that. But so as a subset of that, there will be a senior focus as well.
So where do we decide to leave off on what we want to include? So if our master sheet has both reoccurring and one-time, just so we're aware as a funding group, what's out there that we can utilize, is that okay? Everyone comfortable still having that, but what we show, we can make sure it's grants as are recurring and then do we want to add it by federal, state and local so that we can see how much local support is or is not, and what we're leveraging? Okay. And then, what do we want to break out any of these, not including in the system? Like I know right now we've got it, crisis response, interim housing, permanent housing, prevention stabilization, system coordination. So like permanent housing, do you want that broken out and just include PSH on here? And then we could have maybe a separate section that's like kind of the longer term housing stability. So here's what we're investing in affordable housing. Here's what we're investing in home improvement. Like
So-
something that's more.
Just for clarification, permanent housing, does that include housing for, housing choice vouchers or mainstream vouchers?
I think a lot of this is, this your yard money, right? I think a lot of it is affordable housing construction maybe. Or is it rehab?
This looking at the bigger one to get a better idea of what your.
If you
I
look-
think some of this is SHIP and other,
So, yeah.
for the DR would have been a lot of capital improvements and renovations, so. But definitely, well, that's gonna be one time anyway, so that.
It'll be one time, but I'm just thinking maybe we take it out of this table in general and we just have it as like an ancillary, like here's longer term where we're investing in affordable housing. Or preservation or creation of affordable housing as a separate thing and just really have the system for permanent housing, we'll make it permanent supportive housing. And what's going in that part, and then just keep the rest of these categories, so it's truly more on the. What's in the same, so.
And rapid rehousing, Brenda HUD falls under current housing as well. That's,
Well, I think we would still count that in here, if you're getting people from homelessness back to housing, right? Just take out the affordable housing development and home rehab. Want to comfortable with that? Separate. Table.
So when so I'm looking at funding by program type, it does separate out PSH and rapid rehousing. But then funding by, this funding by stage and system. What's the difference?
So I think this is like, I thought that was kind of like the workflow.
The workflow?
Yeah, like. Frontline and then system coordination overall, but frontline through transitional through. I guess for permanent and be the rapid rehousing and PSH and that one. That we sure.
So these questions are being asked by someone who does not speak this language on the screen. So,
Well, and like, you
It's
said
not clear
permanent housing in this group, everyone's thinking PSH.
Right.
In our development group, that's like we're building housing, it's gonna be there.
right, and I'm more on the development side
Yeah,
often. And I live in both worlds.
yeah.
But it's confusing because I think there's benefit to showing the commitment the community has made to ending housing instability.
Right.
Through a
So
variety
I think
of
we're
means.
not doing it.
Huh?
I've never thought of that. It is, it doesn't have to be on this chart, but it is nice to have as a data point.
Yeah,
Because they think that somehow we never thought to reduce our regulations.
absolutely, because they feel like it's a local issue, so you all better do a better job of it, but you are, so how do we reflect that in a clear way that?
Yeah, because I do have the fear Joe has around this, that let the wrong person get this without any context.
Yeah.
And it will be, used wrongly. We all know that data can be used to make any point we want, and politicians often do. And so, you know, I think however we can reflect it in a way that without conversation and context, no one gets confused that we have 72 million in the system.
We can break it out on separate tabs, even and just have one table that is just our recurring and one table that's our one time. As stuff comes down and then,
I think having the data there, all of it there in one place, that we can create that spreadsheet to talk to the audience that we're going to talk to.
Yeah, I actually like that a lot, because then you'd be able to say, yeah, for this year, we have this much prevention, for this year, we have this much every other.
Getting it all in one spot, we've got it.
Mhm.
Whatever in audience we're gonna go talk to,
Yeah.
we can build that spreadsheet to make our points.
I think we still need to be able to demonstrate like. Judge, how am I gonna know if that's a good amount or a bad amount? Like, and I did, include, I don't know if y'all get Suzanne's, weekly snapshot for the coordinated entry, but I thought this was important too, to like kind of put in context of how many people we're talking about that are, again, this is coordinated entry, so this isn't, this does not include everyone in street outreach and things like that, right? So, just for this coordinated entry, you've got, almost 670 individuals on average waiting for rapid rehousing, right? For permanent support housing. So I think the wait list is another good indicator for why do we need to fund this or why do we need more, like who's waiting to get help. But I don't know how we quantify is what we have in one bucket enough or too much or, you know.
Right, and the numbers from coordinated entry also don't separate out those who are eligible for rapid rehousing or permanent supportive, or
This is both, yeah.
this is a design number.
Yep.
And it gets, and interesting just talking about data and how that works as well, just to throw a little bit of a wrench, is that, so we go by the VI spit ads. That's the initial assessment, but that's not the end all be all. You never just go by a number that was self-reported and be like, okay, that's where you're stuck. Case conferencing happens and you learn more and more about the individual and then realize, okay, this person has like higher needs than is being shown here.
Is that your prioritization tool for that stuff?
But even with that,
Not about
discussion, people can need PSH and you want.
But that's the other
Could
thing
have.
is, right, there's not, so you have people who are actually eligible for or, you know, they score and they are believed to be eligible for PSH who end up in rapid rehousing. So that's the other thing too. And so, yeah, that is not broken. That's something I think we've been looking at.
I mean, this definitely shows the demand, the need for rapid rehousing, right? And likely PSH, I don't know what the breakdown is for the difference on those. So that shows that demand, but for shelter, eviction prevention, we're in first contact right now, but all during the pandemic, we looked at their data dashboard every time to see how many people are calling for rent assistance.
So if they call here, who would then they get diverted to who?
So this is, if you dial 211 on your phone, it's a call center, so they give them resources and everything, I'll refer them to whatever resources they have. There is front door for family homelessness through 211 that diverts to HLA. But yeah, the rest are, you know, someone calls and behind my rent or utilities, they're giving whatever resource they have in their database that person then.
And
Or
when that
they run the program.
Or
Like they
APAP.
run APAP, which is just for adults, and it's one time a year.
one time a year. And then they put that data into HMIS, or they have a separate spreadsheet.
They're separate systems.
But, and those systems don't talk to each other, or do
They
they?
don't talk to each other. We do look at their data though.
So 211 used to run the countywide HMIS, and then it broke out separately and they kept doing that.
It was
9 years ago.
Yeah, so once they broke apart,
Do you feel like you might be missing data from that?
I sent tons of data.
Oh, yeah, we have a lot of programs that don't enter into HMO.
So you're not actually getting an actual look at what the need is at this point. And what would be the reason why they're not, just because they're not funding through the COC, so they're not required to, or?
Well,
And it's kind of double entry, so I mean, I think until we get to a place where systems talk and it's not double entry, that's challenging.
I think it would be their funder, because if they were funded by the city of St. Pete, they would be required to.
Right.
But for that program.
For that specific program, not the whole thing, but that's what we did fund them for, but that's when they ran the whole.
But you can look at their call, you can sort by zip code, you can sort by date range, like we used to do that, we look at like last 30 days, and we look at the last 6 months, and see what's changing, like all of a sudden evictions went up, or people are now calling for shelters, where they were calling for rent assistance, months ago, so it does help track trends at least somewhat.
Would it be possible for the next meeting here to kind of compile some of that data together?
If I can get some specific data asked on it. So it does, because it's a, we have data that already exists. So we can bring that in. And so if I know exactly what we're looking for, it may already exist, and I can just bring that. If there's gonna be a special report that needs to be made, I'll have to get him going.
So is the ask that we want to figure out how to quantify what the costs of some of these interventions are, or is it the ask, like something related to that, or is it? Like, I mean, obviously the wait list can show a deficit in funding. But I don't.
Are you wanting to see the data that 211 holds?
Yeah, I guess what I'm wondering is if there are people utilizing these prevention dollars, but we're not capturing them in one space. It's hard to tell the story that, excuse me, prevention and local intervention is working. Because we're not really capturing all of it.
Most of the COVID money did not go on HMIS. So we missed all of it.
So I'm all about moving forward.
Yeah, so it's, it has been difficult to figure out.
I mean, we may be the only people funding.
Right, we fund some prevention and you fund for, right, I'm thinking, oh, that should be. in the system.
I mean, there is lots of prevention in the
Enhanced prevention.
Yes, we do classify
Yeah,
the Family Services Initiative as prevention, and we are not in HMIS.
Yeah.
We don't have data.
But you have some data that
We
you can share with the
data,
community,
yeah.
right?
Yeah.
So, and the county has, prevention through social action funding loops, what I'm looking at here. HLA has prevention out with challenge funds. I don't see Largo with prevention, but.
Our ship dollars can be used, but ship doesn't give enough admin money to do it. We're like out of admin money already. So it's like I can use them. I just have no way to run it.
And not to make more work, but just trying to, even if we were to say, let's take this time period and come back together with this information, would that be helpful in identifying where the dollars are most used and where do we need to pivot moving forward based on whatever changes come down from the federal level? That, I mean, I was just looking at it very simply that way, not to make it more work for anybody.
So it sounds like, I mean, one thing is then it's pretty easy to take the number of clients served in a period of time, or divide into how much money has been spent to get cost per capita, like the cost of the intervention on average. And then, but the hard part is then cross-checking how they got the homeless system. Like, did it work?
You can do that, but they could pull the HMIS number, so 30, 60, 90 days, 120. I wouldn't even do, maybe not 60, 30, 90, 120 and see if they hit the system that way. That would speak to whether or not prevention is working. I mean, if I just took out some of the top numbers and there's about $5 million in prevention if I took out CDBG, and what I think might be our single family, so CDBG, SHIP, CRA, those kinds of things. There's like $5 million, and you're right, the city does majority of it, and then JWB actually does a little over $1 million and one program. So
Maybe just take the 90 day, like just take one of those points just to, and maybe we just use a sample program to see at this point. What
I
the,
think the only way you would know is if you hit the whole, you have to hit, because otherwise you wouldn't know if they recidivized into the system. Like prevention, you could have given me prevention in January, and then I could have come into the system in March. So if you don't hit like the 30, 90, and 120, you wouldn't know if I touched the system within that time frame, because prevention is supposed to be short-term for longer impact. So within that 6 months, did they touch the system?
but like JWE could look at HMIS to see if they're, yeah, so I don't have to use like a test program, like if you guys have that data in, like take one of those to look at that program versus trying to pull the ones that are not in HMIS.
If you did a program, then you're only, you wouldn't get that, because they can't use like AFAP, they can only use once a year. You can only use certain funders agencies are only gonna let you use their funds one time, so you would have to search the whole system. That's the only way for you to know, and you wouldn't just be searching for if they touch prevention, you'd be searching for if they went into shelter. But I do think we have that recidivism report, so we could use HMIS for creating the prevention part, and then we started the recidivism report for the collab, so we'd be able to pull that, so there is data there. In those, if we just use those two interventions, then we could have some information.
So then, what do we need to do? What we needed to fill in the blanks?
I think on filling in the blanks, we just need everyone to go back through and look at what is the, like, where that's missing, but we may want to break out. I guess we'll put as a separate table, affordable housing development, and the home repair. Let's see, we're gonna put the one time on a separate one too, and then we'll break out the permanent housing one into PSH and rapidly housing.
So do we want to recommend that we come back to this format, make the changes that we discussed, and then we send it to everybody in this group, asking them to fill in the blanks for the next meeting?
And we still have someone from the VA on here, right? So I'd like to make, we don't?
We,
Oh, we do.
we did not get a response from the VA.
About sending a member? I thought we always got,
Well, I'm saying there.
We have a member, but
Oh,
not everyone responded to the request.
Uh,
And they're okay to move forward that I haven't. I am talking.
That's okay. We'll make sure. Go with the HLA.
When we send this, is there a way to be specific? So more like the question I asked, you put that back in email and then you send it to everybody, but also like prevention, rapid rehousing. You're thinking rapid rehousing is permanent housing. Like what each category, what each program type means. So that way that would help us
Like what
understand.
stage in the system it
Yes.
is. Okay, so put a little P.
I think we also, and I don't know if this was meant for the operational challenges, but I think we should put some of those restrictions, like Helen, you said ESG is 30%, like that should be noted here. Because
Yeah.
I agree with, I think Joe and Amy, like just this getting out is not gonna be great. We're gonna say we're saturated with funding, we don't need it, we can start cutting general fund allocation.
Which is on this now.
Yeah.
Just believe that, there is a column that we ask that question. The operational challenges and barriers.
Like, to me, that's
But-
what are the operational challenges,
Yeah.
drawing it down, not special populations or restrictions or.
I
Right.
think restrictions might, because it would be 30% AMI.
Have it as
Even something like 7.5%, which is something that it didn't even cross my mind, but with brush admin costs, those things, so that people know that
And so eligibility notes would not be.
we could do that maybe.
Well, that's where I'm seeing literally homeless or the AMIs.
Maybe we'll just specify that that's what that's for. We can
Yeah,
put a
I
little,
would put
you
it-
know how you put a little comment on a heading, so we can do that with some like. Okay, little how to's on that. So I guess we can work on getting this like where we need it first, and then we'll figure out how to more so measure like what areas are we lacking in, but then also we have to figure out how to shift, I guess, for this major federal shift too in priorities and how we're gonna. Does that mean joint, it's probably better in joint funded providers for any system shift, which is not providing services to be a part of that too. Do you all feel like if we get this updated though, maybe that it's an every October thing, like once our budgets, I usually have an October one. Once our budgets are finalized, update it for the new year's funding, and then we're not gonna update it every month or anything like that, it'll be where we're at. with money.
Yeah. So I've got another question. Individuals with behavioral health needs, those dollars are for what? Is that actual housing, rental assistance, or is it services?
I interpreted it as services, but I don't know how everybody interpreted it.
Well, I'm looking at the, are we looking, where is that? Because I did
And
a,
the population served. But it's also, I think I saw it under funding by program type.
So it's on the bigger one, it's DCF, ESG. Through HLA, so that's where it says it, and then DCF Rush through HLA.
For the individuals, for you give your
That's a primary population served. Those two areas is what it says.
But look at how much is one-time funding on that.
Oh,
Oh my gosh, that's scary, right?
The bigger pot is one-time funding. Is what it says on the bigger sheet.
But like that may be it, I mean, if our chronic homeless population and our hard to rehouse folks are falling in that component, that may be something that, you know, needs to, I know you guys were doing a huge amount, and then the opioid settlement city too, is that not one thing?
no, we don't have opioid settlement in there. I think this is the Samson grant and the DCF grant. So the Samson grant's almost 3 million and the DCF grant's over $1 million.
and they traditionally fund services, correct?
Yeah,
So,
those two are service-based grants. Those are services of Safe Harbor.
And, yeah, here's the tricky part though, too, it looks like HUD wants us to like get everyone back to whatever state before they get housed, which doesn't help with like making sure they're getting us the services after they're housed, right?
well, they're really, their emphasis is on treatment and recovery.
Before they get housed.
They haven't defined that, they're not.
Not a requirement for
I
it.
thought that was a requirement.
More housing is how I.
Yeah, it doesn't mean you can't get housing, it just means you have to be in agreement, like, I don't think we're going back to the days we had to do drug testing to get someone into housing, like, I don't think that's not what I understood. That's what I'm going to pretend to understand. But I just,
Sparks is already a little bit out there.
I mean, we still have people who are doing testing to get into the emergency shelter.
oh, okay. So you're not gonna have to switch back from housing first too much. But I think it's just saying if you're gonna get into housing, you have to be willing to go into treatment and recovery. The question is for people who are currently in treatment for severe and persistent mental illness, that, you know, what do they have to prove? So I think that the implications in the masterclass of spinning yesterday was that behavioral health is a big component, that they're very supportive of making sure that those folks don't lose their house. So I don't know what that means. And the folks who are using are not really in the mix, but the folks who have mental health issues there seems to be more alignment with, and he referred to the SAMHSA RFA that was just, NOFO that was just released. So I think what they're moving towards is what the state has wanted to do for a long time is build the buildings and then let the other state agencies fund services and housing subsidies. Like, I think HUD's trying to do that on the federal level eventually, but I do think it warrants just having that more information about it, because I think, as Amy indicated, that is a huge scoring factor for a collaborative application, is to show that you're leveraging dollars from the behavioral and primary health community, the hospitals. They're supporting folks, so HUD's not paying for everything.
Yeah. That definitely sticks out on that chart.
Yeah.
It's like one of the big areas that we have a large amount of one-time funding in. That's not gonna be a need to go away. But
It is the same sort of,
that is.
Karen, did you have a folder?
It's Samson, I think DCF.
So, and that is considered, like, that's 3 year, 5
3
years.
years, 3 and 5. So the criminal justice reinvestment grant is 3 and then Samson's 5, but we're already in. it. So it's not like 5 more years.
Right, so, but not able to pay to continue.
Oh, no.
Okay. All right, so we're gonna work on this. Make some of those changes and then send it out to everybody to fill in the dots and make sure everything's correct. And Arrow, did we kind of cover everything in that discussion, or is there anything?
I think so at this point. I mean, I think we still have to refine the chart and then it's figuring out, and this might be up to be on BSP. I haven't been yet. I've been trying to figure out how to add another meeting, but I know you have, but maybe a good way to tie in with BSP on how do we go about taking this data and making the case for, or like evaluating the system on where we're underfunded or overfunded and where we need to shift and align with the HUD data too, so. I assume that's gonna be funded providers meetings. So.
Mhm. Anyone have any suggestions for that?
I think we need to make sure, saying this big part of HUD's component too, is that, I know we've got the sheriff's office at the table, we've got to keep law enforcement, and I know our street outreach meetings now seem to be bringing that side of operations in more too, but be more in step two when it's.
I think that, this is gonna sound wonderful, living in Florida is actually right now,
Perk.
really good, yeah.
Yes.
We we are one of the few COCs that does have excellent relationship with law enforcement, and representation on the board. That goes a long way. And of course, Safe Harbor. I mean, there's the work we did on the task force. We've received some data. I don't know that, so I'm trying to get like more current data around encampments, and arrests related to all of that. But there was a time where you could see law enforcement, Pinellas County Sheriff's Office would go out and how many encampments existed based on the definition they had, and just it went down over time.
We can use their data too to leverage like even Marksman Act beds and things like that, like if we need to level, because like case in point, we just had this guy, I mean, guaranteed he was gonna die on the street if he didn't get in someplace. Finally got, Marksman Act got placed in Broward, they sent him a bus ticket back here, and the judge said, like, overturn their decision and let him right back out on the street in a wheelchair, keep rolling in a check. But we had him placed and everything, like, so PD is dealing with that again and again and again and again. And so like, I think having them at the table to advocate for some of this type of stuff will help, especially with the mental health and behavioral health.
I do, Sandra and I sometimes attend this meeting. Well, Sandra always attends it. But I found it super helpful, and I'm hoping we'll get the slides from this week because they're really good at previewing what, is coming. And there's been a lot of conversations in the VA world about, required guardianship. And, at the federal level, they've really been looking at Salt Lake as a best practice. And so this group had kind of taken one of their proposed facilities and cost allocated it out to provide an estimate of what it would cost. And it is significantly expensive. And so I will share that, I am a proponent. Certainly I'm not a proponent of Baker acting or Marchman acting. However, there are times that our unhoused individuals need a higher level of care for severe and persistent mental illness. And that's why the city started the Firefly Project to kind of look at that and provide a different level of support. But this is coming. I mean, this model has 300 civil commitment beds in it. It, has a number of other beds in it. So I'll share that with the group if Sandra and I ever get it,
I'll
but
work on getting, I got part of them today, earlier, but wasn't.
I was able to take a screenshot of some of the slides, but I also think we need to start having the conversation about, that the interventions that we have been successful with are significantly cheaper than the interventions that are on the table. And so, yeah, I don't even know what I'm trying to say, but the Marchman Act made me think of it that, what I'm saying will be coming is significantly more costly for us to financially support. And I have no belief that HUD is gonna ante up all those dollars, nor is SAMHSA. But that civil commitment piece, I think everybody keeps thinking like, this is just, fodder and it's not really gonna happen. And based on the models they're presenting, it's gonna happen. And that we need to be, also committing high utilizers.
I think we have, with the support of law enforcement so much in this county too, whatever interventions do work, I think we have a law enforcement group that is very proactive about picking interventions that do work, but having their support behind them and their voice sometimes will speak louder than ours.
Yeah, I think you're right about that.
Yeah, and they're also modeling, some of what's happening in Utah is modeling after Judge Leitman in Miami-Dade, the jail diversion program that he created under the mental health court. And that definitely has pluses. I mean, I've worked within that system for a long time, but I think there's just such a trend towards continuing not only the criminalization of people being unhoused and living as they choose on the street, but then forcing people into either losing their rights and getting some having guardianship over them, like the VA, that whole piece, and then just forcing them into these communities as part of their effort to keep them out of jail. So I think there's a lot of red flags. It's interesting that the data gets twisted because there's been so many studies on high utilizers, and what's most effective for high utilizers in a system is permanent housing with wraparound supports and services. And there's Florida-based data that shows that I just feel like I immaturely want to roll my eyes every time I'm in a meeting where they're talking about this new study of high utilizers and what's effective. And this one has not ever been identified as effective, but it is kind of the tone of the federal government these days. So, but I think it is something we have to be aware of and kind of be able to pivot with these, like what has been effective, because those type of things aren't typically effective. But I will get those slides, because I will try and get those slides and we'll share them just so people can see them. And any other information that comes along the way, because, there's the noise and then there's the actual what's happening. And so I think I've tried not to pay attention too much to the noise and really try and get some details, because I still haven't recovered from November and December personally. So I feel like I need to prepare, everyone does for what June will come, but I feel like we kind of know, so it's a little bit less stressful. Not to say not painful, just less stressful, but the last part of our agenda is for all of us to talk about the federal policy shifts and language. And I know during the last, I think it was the funders and provider council meeting, I get them.
Oh, I know, I understand. The joint meeting, yes.
Just that one, there's a discussion about the languages in the contract and what, I know there was I think there was an assumption made that everybody was on the same page, but I don't think everybody was, so we said we'd bring it back here to kind of go through with the people who are drawing up those contracts on what works and what doesn't. So you have this piece of paper,
Yeah, this was from the joint councils meeting back in October.
okay,
And it's when we had started this discussion, and I don't think we made it terribly far. There was a lot of back and forth. Some of the things like the using sex versus gender, we had good robust discussion. There's been a lot of stuff. DSP has talked about this, Status Performance Committee has talked about this. Had changed their universal data elements from, took gender out of there as a system we could keep it in, but required sex, first sex. And, in the conversations, the question, very good observation was raised that are we putting people at risk by collecting gender as well? So removing that and we just went with sex. And so, that was one area.
but people can define themselves, no,
It's self-reported,
Okay.
but it's male, female, or refuses, prefers not to answer, or unknown are the responses. And so we can look at those refuses to answer as a indicator, possibly. But that's the way DSP is looking at it now, yeah.
As an
But-
indicator or?
Of, maybe someone doesn't identify themselves in the genders that are available. Or the sexes that are available.
So if I remember correctly, I think housing first is what generates.
I brought it up, yeah, because I do think that we need to make recommendations on where to land. And then I know my board has asked questions about our resolution. Are we repealing the housing first resolution? I don't know if other cities had those resolutions, what you've done. But, we are in active procurement for some housing, rapid rehousing is one of them soon. And then we have social action funding, which we'll be bringing to the board. And some of them would have this language. So I don't know that we've landed anywhere, right? As a
When
system,
we were, as a system, no, and other than, so when we had this discussion, HUD-TA was telling us, you still have a HUD contract, and if this goes through, then you still need to keep some of this stuff, like you're contracted to do this, and then you're told not to over here. So there's the politics, and then over here, what can be enforced as well. So it's very difficult to kind of wade through that. And so to give like a definitive answer, I would say that more recently has been firmed up where housing first is not. And looking at other places, they use terms like housing focused with services, that sort of thing. That's been a common one. I liked, Sandra, you mentioned something during that last meeting that instead of, my little soapbox is sometimes whenever we have these little a cute catchphrase or something that's supposed to mean like a short, you have two words that is an umbrella for a lot of things. And then people will define that the way that they want to define it. So housing first, when you say housing first, Kevin Marone will sit there and tell you, well, that's not housing. I know, but the people who are making it, they don't know that, or they do, but it's being turned into something else. And another group may have defined it another way, and that's what's giving it a bad name or whatever. So I think that just being clear on what we're saying could be another way of going about it instead of packaging another catchphrase. But either way is fine. Housing focused with services is one, and you had mentioned something.
Reduce barriers to housing.
Reduce barriers to housing. That is, saying what it
Technically,
is.
that's what housing first is. It doesn't mean that you stay in housing if you're not playing by the rules, and it doesn't mean anything else. It just means that we reduced all the barriers to get you into housing. But it also implies that we're not gonna do criminal background checks.
That's
It's
it.
gonna be income limits or maximums, and that, if you show up actively psychotic or actively high, we're gonna still house you. That's the implications. So I think at the risk of being completely, like, why, what's the necessity of even using housing first or housing focused at all? Right, is it necessary? Because I mean, thinking about before housing first became the catchword in 2015, we used to say housing is a right, not a privilege, like, we would say that we would reduce barriers to housing, but we didn't have to announce that we were doing it. So it was more, it was in the work, not in the statement.
In the scope of there's your work plan.
Yeah.
Right.
I think it's just because as a community, at least for the county, the resolution was adopted, and then it's in all of our contracts. So we have to unwind that. So it's something, so we either silently remove the whereas clause that we are a housing first community and we're silent on it.
We did.
So that was I didn't know what I was gonna do.
We took it out. Last year, we kept all the HMIS requirements, things like that, and then you could take it out of there.
Okay.
Right, I mean, and do you have anything that implies that housing is an area of focus for all?
We include the very brief and one-time missions.
Mhm.
So, whereas this supports missions. So I was also curious, another thing maybe is to focus on the acuity level of the people that are served, so there's not cherry picking with those, just the lowest. Yes, for that scores as a way to go around that too, because if you're requiring to make sure that they're helping people even at the higher end of the scale, like get into shelters and things like that, they probably have those barriers. It's easy to take the ones that you can get jobs quickly and get back on their feet now. But maybe that's a way to like show how you're assisting people with higher acuity to get that state.
But is that in the contract language or the selection criteria for awards?
Well, we used to have the housing first, there was a questionnaire
Right.
that we all had that went with our applications. Do you do this? Do you have this? That. And so I'm thinking maybe in place of that, maybe it's something like that.
We did, I will say for social action funding, we changed it to housing focused. Because we still want, in my head, we still want the agency and the resident to know that the goal is housing, ultimately, not permanent housing. I think I took permanent out of there and just said supportive housing in some places, but we did do housing focused. And that is what is in our application. That will be in our agreements. That's what I changed over there as well.
And Karen, do you feel like changing it to housing focus, because your dollars are focused on housing, correct, or not?
Yeah, I mean, for the contracts that I'm thinking of right now, I just, previously, we had a unified kind of unified response, unified template. So we had this conversation and then we said we would circle back. So I didn't want all of us operationalizing the language differently because we had made a commitment not to do that.
And other than the housing first, are the other elements here that are listed in alignment with everybody?
So all of these words are not, so I think when I think of words like low barrier, like, does that mean the same thing for everybody now? I guess that's dependent upon your program. Are we going to use that same word or do we say, what was your phrase, reduce? Right, so it doesn't mean that it's no barriers, it just means that you might not have to go through everything, jump through every hoop to get through. I also feel like with Housing First, and I know we don't say it, but I tell programs all the time, just because you're housing first doesn't mean you don't have rules.
Right.
Right, and so that's why I think housing focus still gives them some teeth that makes it feel like they still have something, because it's your program to run, you still have rules. So I think if we can just give agencies something that feels better than everybody just saying, here's our agreement, and part of that is because then they have different things that they have to account for with every single funder, which already happens. And I think that's what we're trying to eliminate.
I do like the housing focus, I know. The street outreach person, like he explains to clients, you're not just going to shelter. this is rehousing program, your jobs toward getting back to the permanent housing, like. That ties into housing as well, the same.
Right, and I don't disagree with that. I'm thinking, what Helen was saying though is, and I go after funds, so I live in the gray area of that language, because I just, and I don't apply here, so I can be honest about it, but I live in that kind of vague language, so I'm not trapped into something that, 6 months from now, I can't evict somebody, or I can't do something because I committed to this, this, and this. And Housing First never told me I couldn't, so it told me I couldn't do a criminal background check when someone came into the building. But if they got arrested, I could take action. So there's a workaround. But Housing Focus doesn't mean the same as Housing First. To me, Housing Focus means that you're all looking for housing money programs that are gonna get people housed. I think an applicant is looking to get the money, right? As we should, that's what we need to get. But I wouldn't, my job, I'm housing focused, so I check that box, but am I making the same commitment that Helen might be making for her application, because she's not gonna do some of the things I might do? Does that make sense?
Oh, it does, but I think that goes back to the program makes the rules.
Yeah,
But you can tie it in with housing focused for a very brief amount of time too, like your job, whether it's out there or keeping them housed, so it is not back.
but what if you have a provider that applies, who says that in order to come in, they have to have 2.5 times the rent in monthly income, they have to pass, we have a look back period of 5 to 10 years for a criminal background. I mean, sexual offenders are off the table anyways, and they have to have, I don't know, a clear drug screen from some treatment provider,
Are you
like,
talking about for like permanent housing?
yeah, permanent housing.
I think a lot of the contracts we're talking about are.
Or even rapid
getting to that
rehousing.
point, right?
No, I mean, I have PSH.
Yeah.
And this is where having something like the catchphrase does get in trouble. So when I was a funder for developmental disability projects throughout the state, the word inclusion, and we wanted more inclusive settings for folks, and that's who we would fund. And the most non-inclusive segregated settings would just borrow that language, we're inclusive. We believe in inclusivity and over and over to where it just lost its meaning. And so that's, yeah, and so we had to put it down in the scope. This is what we mean by this.
Right. But if everyone here who's applying this to your RFAs and contracts agreed housing focused covers the elements that you want to secure in those dollars, that they're being spent in that most efficient way with the least harm to the individuals you're serving, and will help create a one-time non-recurring event. Does that cover it?
I think it does, but I honestly don't think we can hold any agency to the one-time non-recurring
Yeah.
event, because they're not going to be responsible for what happens with the individual once they're out
But
of the
that's
program.
the mission you're headed toward, like
That's a goal.
hoping that they support that mission, and how are you helping to support it? Here's what we're doing. Right.
Focus and reduce.
Are people comfortable with housing focus?
The only thing I think it all misses again, though, is the people that are harder to house. Are. So they get, the ones easier to house get cherry picked.
But if you're doing prioritization, like, how would they get cherry picked?
But there's only prioritization. Well, that's for sure.
I mean, there's prioritization for everything.
Yeah.
There's coordinated entry, and then there's the shelter prioritization list.
That's not individual.
Well, there's no coordinated entry for, well, there's no coordinated entry for shelter anyway. Coordinated entry is for housing. So then I would say, yeah, then housing focused, for the harder to house or the easiest to house, just your goal should be housing.
Right, because you're expecting when a provider applies for funding, they're going to outline their target population, the scope of services, what they're going to do, and you're gonna score their application based on that.
Right.
Not necessarily because they checked the housing first questionnaire.
Absolutely. At the Housing First questionnaire for social action funding to some extent was punitive, but really it's based off what they put in their application, how their program runs.
And would that be the same, Karen, for you, your applications?
Yeah, as part of like, purchasing and grant cycles, I mean, to me, it was more of a, a philosophy that we adopted as a continuum. And we attempted to make sure that programs that we're funding were in alignment with that philosophy. In the absence of it, we have the HUD's new philosophy that's coming, right? So like the requirement of treatment. My fear is in the absence of some other policy that the COC is adopting, any new funding is going to fall into this bucket in front of some of our electeds. That's kind of my, so without the statement, without the philosophy, without what we are adopting as a community for non-federal dollars, it's going to default to, I believe, HUD's philosophy.
So
At least I will say in front of the electeds. That's my fear. And we aren't running programs right now through general fund dollars that have those same requirements that we believe HUD is going to have. Like rapid rehousing, you are not required to sign on for treatment with our funded program. It's helpful, right? Like with the families individuals we're serving. So without it, that's my fear, right? So we bring it in front of the board and it's like, well, this is HUD's philosophy. Why are we not following it? What's the COC say? What is our philosophy? That's my
yeah,
concern.
no, it's a really valid point. And I'm wondering, this might be, I think, something that the COC can. I'm thinking out loud, again, sometimes that's good, sometimes, but, that there should be a written statement that you can refer to. This is in alignment with the COC, and the COC has a statement of what their maybe housing focus means, or whatever barrier, reaches barriers to housing is our it's our objective to reduce all barriers to housing based on prioritization of those most in need of, and and I'm kind of putting something out there that you can refer back to, but.
That was my intent. And
Yeah.
typically it gets given to committees. Committees make the recommendations, COC votes on it. I thought that was the intent of this document in October, but then it paused. Right, so
Do we want to make a recommendation to go back to the funders and provider council to vote on, to go to the COC to vote on?
I mean, I think so, but I mean, if everyone's comfortable kind of just like operating within their own contracts, we can do that too. Like, I also don't want to put the COC in a place where they're adopting something that doesn't align with HUD, and that's gonna hurt the points later, right? So
Yeah,
like,
I think it's interesting because COC as a HUD only exists because it's a HUD entity.
But I don't think you have to be out of alignment. I think you just have to use the right words.
Just right. But but it could cause issues while we're trying to be in alignment with HUD. Just what Karen's saying, was what the county could then go for. It shouldn't impact what local funds end up being used for. I don't.
But I think the threat of local funding is if the local leaders just want to be in alignment with HUD, then we're at risk of going 100% that direction.
But is HUD, I mean, bottom line, is HUD still trying to, and homelessness, like, will get housed? I mean, if it is, and that's the same at the local level, right? We're trying to end homelessness to the extent we can, but so the housing focus does keep at least that focus on, that's what we're all trying to do, whether we're at the federal or local level, is get people housed and keep people housed. Lost me on how we get there, might be. If we all agree on that.
So when you see it that way, then what I think, based off what we heard, if you said housing focus at the COC level, then there would be some pushback. Because your question is HUD still trying to get people housed,
I don't think the answer to that would be no, but I think based off of everything we've heard, they want a person to get themselves housed. They're providing the transition to that housing.
They don't want long-term.
They don't want long-term housing. So if we just, could we, as a group of funders and providers in our stuff, say that it's going to be housing focused in those things and not just keep the rare brief in one time at the COC level, which says the same thing as housing focus for us. Could we just agree in that way? Because I think if we use housing focus in COC, then there will be that kickback.
So why not just?
Eventually. Rare brief. Because in our resolution, our social action funding resolution literally says our funds will be based off what the COC says. It's priority, intervention, and where, the way that they're going, basically. And so I think that we're agreed on one time is enough.
We're trying to get people not to be back homeless again. But like, you know, that's. Is there an issue then, just to be back in the very brief one time?
Our stuff is done. Like where our application is open and out there and the myth with housing focused on there. Only because we had to get our stuff out at the beginning of May. But I feel like county just closed
I think Robinson just closed.
or social action funding.
Oh, social action fund, yeah. It's
But I
closed
do-
and scored.
I do think this decision matters for the repeal of
Right.
the previous resolution
Mm-hmm.
to Karen's point about, as a community, we've agreed to X, Y, Z, so even though the applications are open.
So. Trying. Wrap this in package, keeping, what I'm hearing is housing focused towards a rare brief one time recurrence, forget that order.
Housing focus for the mission.
With the goal of
Or having homelessness be very brief.
and you see the COC adopting that language or staying away from housing focused at all?
Well, I'm curious more about what Helen was mentioning about the issues longer term.
I'm just wondering what that looks like at the COC level based off the conversation that was had and that had what I took from what I heard and Dr. Mar would say, and what I heard on the meetings, basically housing, they're not interested in permanently housing anybody.
They're not.
They're interested in transitioning people to be self-sufficient and get their own housing. And so if we said housing focus at the COC level, I don't know what that could mean. Because that would be another catchphrase to fit onto. But my question really was, if joint funders and providers said, yes, this is what we're willing to do, does it need to be adopted at the COC level? Or would we all be okay with just agreeing that this is where we are going so that it doesn't put the COC in any jeopardy?
Right. Because the mission's still.
It's still the mission.
Still the mission.
I'm happy to include the rare brief in one time. I feel like we have that in there somewhere, but if we don't, I'm happy to include that in our agreement. Or maybe in our resolution, which drives our funding.
I'm fine with that.
Yeah.
I'm good with that.
Okay, so
So should we at least make a recommendation, like, funders here, do we want anything to formalize?
And if we want to wait for the NOFO to drop to see kind of if there's any other things in there so that we're not, going back and forth.
Yes.
And only, there's only been one ask of when are we repealing the resolution? So it's not like it's hot on, a lot of minds. There's other things we're talking about for COC and stuff right now.
can I make a suggestion? The NOFA's due out by the first, around there. The joint funders meeting, provider council meeting, I believe, is on June 26th. If we could, maybe Al, Sherry, and I can kind of draft something, a line or blurb based on that, based on this conversation, and send it out to this group.
Sure.
Before the 26th meeting, and, plus we also talked about maybe meeting in June, once the email goes out, to kind of follow up on this conversation. And then we can bring it, once we all agree, we can bring it to that council meeting.
I think that would be good too, for whatever we end up with, at least advising the COC, because there's elected officials on there, and if we bring a repeal to a resolution before them and they're caught off guard,
Right,
we probably need to be able to like explain to the board at least first, like, what does this mean?
Mhm.
What's basically-
is that not agreeable to everybody? Perfect.
So
Any,
to Karen's point there about the NOPO dropping, I know in our meeting we had Tuesday, there's a big talk about the treatment component that's coming down or potentially coming down here that we may need to include in that housing focus component.
Mhm.
When Karen starts trying to find more treatment money or something along those lines. So I agree, waiting till after that NOPO to put everything in the package. But it may need treatment as a part of that as well.
right, well, and
Focus with services.
and going down this list, services and treatment and recovery, I'm assuming because the resolution was housing first and everything was about voluntary services, that is gonna be a shift, because it is, that's gone away. But other than that, and harm reduction, of course, is off the table as well. I mean, anything that even relates to drug use and like provided support of anything, and we got into nuances about even narcon on site, because that's considered, I guess, harm reduction in some worlds. So I think that is something we would have to make sure it's not language that is written somewhere, correct? You know,
I thought it was more about like safe consumption sites.
Safe consumption
I didn't-
sites.
they haven't clarified.
Yeah,
Um,
but Margaret pretty much said people can use as much fentanyl as they want because they're walking around with little bags of Narcan on them. And
Yeah,
that's
he was living Narcan for a lot.
I
Yeah.
thought I was not. I didn't think that was. So you're
Right.
You need that.
Yes.
But even at that point, the mission statement is the outcome, the services are the how. So you can have everyone driven toward the same outcome, and how they get there may be different in your things. And that's where the services come in, like how you keep it from happening again, where you provide services to keep them stabilized. So I think it still covers everything on the outcome part of the bigger picture.
So was there any other this language? I know there's a big discussion about save, but that really is a requirement, and I've heard some counties have access, not all.
We documented Wazoo and on NASED calls too, that everyone, federal government, they just are across the nation and saying, just contact your HUD rep a million times and document that you've tried, which we all did. We all talked to our attorneys, and they finally came out positive, saying they're now working with SAVE, since SAVE literally would not let us get access to it. So they're not set up to do that. So that's where it lays.
I think Brevard County has some access, but
Oh, the housing authorities have access, and like
our,
guys have
Mills
for
County does.
something, right, for something.
Or doesn't your state?
Yes, for, I know the housing authority, every housing authority, because I think the health authority from the county. The housing authority does, and
I'm sorry, so for the housing authorities, when, the housing authorities were told that they had 30 days to verify immigration status and using the same system, they were going to be given a match report because they don't have access to SAVE, and they're still waiting on the match report. I talked to both Danielle and to Elise about that, and they don't have access to that system.
but is that necessarily something that you require in your contracts? No.
No.
Not for my general.
The area that comes up as a concern was, then SCOCs, we've been talking about this for a while, is in the first NOPO that dropped, it's as part of the points, and of course, the gentleman who spoke to us, from HUD had mentioned, well, you get to determine how you want to get your points. You get to prioritize your points and all that. But if it's an impossibility, it's impossible. One of the points areas was that you would attest to every single provider in your COC, not just receiving COC funding, but in your COC will report and use the safes and stuff. Which just is impossible. At that time.
It'll be interesting to see how, because I know it's problem, so it'll be interesting.
We've been challenged, I think, in DR for months to even get answers to say contract things we're trying to do, so.
The issue too, HUD has not changed their regulations to say that this has to happen.
No.
Right.
That's the piece that we've hung around. When I have a regulation to change my contracts and the way I'm doing business, then we'll go. But the regs today do not tell me to go do. And that's kind of the stance we've taken so far. And, you know, we're still waiting.
Yeah, we just told ourselves to be in your contracts. Know that this may come out, we may have to do an amendment at some point if they.
With the lack of staff at HUD headquarters, that ain't gonna be anytime soon.
No, in fact, I mean, his reference to all of that was that because of litigation, they haven't been able to access those systems to update eSnaps, to update the guidance, to update all of the regulations. It's like, okay. We'll just see what happens, because I personally feel like we're heading into another long back and forth with the NOFO. It's gonna come out, and then there's gonna be litigation, then it's gonna be all kinds of stuff, and we're gonna be on hold. Then we just need to be prepared for that. Before we wrap up, I think I'm just gonna, if I missed anything, for the first part, we're gonna, schedule a follow-up meeting. Once the NOFO is dropped, it will be virtual. We're gonna try to do it sometime in June, early on, but before the 26th meeting with the joint council. We're going to send out, Aaron and Terry are gonna work on the spreadsheet, make the adjustments that we discussed here. And then send that out for people to fill in the gaps, and provide any other information that is needed. And then we're also going to, make a blurb that we're gonna send out based on the NOFO, based on what, is it housing focus, is it housing first, and then send that out for everybody for feedback. And we can do that, or, we don't have to have a meeting for that, people can just respond. And then, I'm a big supporter of no responses agreement, so. Can't say it. So if there's no response, then we'll all be in agreement, and we will send that to the joint council. Like provider joint, what do you, is it funders and your service, thank you. That meeting. I don't know if anyone else has anything else to add.
It was a great meeting, thank you, Susan.
No, it's a great. Thank you. This was great. I learned a lot, so I appreciate you all meeting.